Hello, I'm Michael. Welcome to Ask the Professional. This is a new series I'm hosting to ask my guests who are in the healthcare professional. Can we start again? Focusing on information and resources for those who may be suffering from the pandemic. Today, I'd like to introduce my guest, Ricardo Ruggiani, who is a registered mental health intern on the staff of CHI, which is Community Health of South Florida. Welcome, Ricardo.
Thank you very much, Michael, for this opportunity.
Thanks for being here today. Today, we're discussing what people might be experiencing as far as mental health issues due to the pandemic. And so can you tell us a little bit about what you're seeing in people now that maybe they're experiencing that they don't know that they were experiencing before?
Absolutely, Michael. Well, specifically in CHI, I am witnessing an increased demand for behavioral health services, and also this is because an increased number of suicidal ideation among patients. I am also seeing an increased number of stress due to personal losses. When I talk about personal losses, could be physical losses like businesses, programs, projects, and also unfortunately deaths of people, right?
Right. And a lot of financial losses too.
A lot of financial losses, especially those who work in retail or those who have their own business or are self-employed. They're struggling the most.
Because there's so much unknown of what's happening. Nobody can't see a future really.
Yes, that's another thing. And for that reason, there is a big increase of depression and anxiety diagnosis, especially anxiety. In my case, I have been seeing more anxiety than anything.
And what kind of things happen to somebody who's experiencing anxiety?
Anxiety, it's pretty much a body natural response to stress, which means it's a feeling of fear or apprehension about what's to come. In short, anxiety has to do with fear for the future, but to the extreme. But as I mentioned, it's normal to feel anxiety. But sometimes when you carry the anxiety to the extreme is when the problems start. Especially because anxiety can lead you to developing panic attacks, and in the worst case scenario, it can lead you to develop a stroke or heart disease.
What would happen to somebody if they were experiencing a panic attack? Like if they've never had one before, what they would recognize?
Pretty much physiological symptoms such as chest tightness, excessive sweating, increase of heart rate, and in some cases some headaches that can turn into migraines. And there are moments in which the person feels that actually they are going to have a heart attack. But I want you to mention, Michael, that not necessarily the person is having a heart attack, even though the feelings are if somebody is having one. Right?
Yeah, the feelings just are very exaggerated.
Exactly. Most of the people who I saw that experience a panic attack pretty much start thinking that they are going to have a heart attack, but at the end of the day, a panic attack would never kill somebody. It's totally another thing, and it's more psychological. It's pretty much more somatization than anything.
Right. Yeah, but it's a pretty bad experience.
Absolutely. As feeling anxiety, because anxiety, it's a natural defense that we have, but at the same time, it's a very uncomfortable reaction that we have.
Yeah.
Right?
Yeah. And what else would be maybe people experiencing?
Besides these trends that I am witnessing in my clients, I am seeing like a lot of extreme reactions towards the pandemic. On one hand, I am seeing clients that are extremely concerned, very paranoid, very fearful regarding the pandemic, and they are pretty much panicking all the time. But on the other hand, I am seeing others that are taking the pandemic too light, in my personal opinion. They think that the pandemic is like a normal flu. They think that nothing is going to happen, that
it's really not as serious as they're hearing. And
Exactly.
yeah.
Exactly.
I think if you don't actually have somebody that you know who has had it, it doesn't seem to be real. As soon as members of my family were diagnosed positive and my father went into the hospital, it became very real for me. It was not something that's out there. And I think it shifted for me when I actually knew somebody who was affected by it. It became very real.
Somebody too close, right?
Yeah.
And sometimes happen, right?
Yeah.
That until somebody close to us doesn't get the virus or the bacteria, well, the virus. Until somebody doesn't get the virus, they don't pay too much attention, and
Right.
they don't realize that, oh my God, this is real, right?
Yeah.
This is real.
Okay. Are there other things maybe somebody would be happening to them?
Well, what I do in CHI, what I do is trying to help people know, to understand that none of the extremes are good. I always try to make people to set themselves into the middle point. With this, I mean like not too panicking, but at the same time, not too light. Just only take precaution and do what is in your hands, always. Because sometimes happen that we try to control something that it's in the environment that unfortunately we are not able to see, right? So sometimes this is a big limitation. So for that reason, I always encourage people to be realistic and do what is in your hands.
Right.
Like
There's a lot of
wearing
fear
your-
of the unknown.
Like wearing your mask, like washing your hands, respect the social distance, right? And avoid high-risking behaviors such as smoking or doing those kind of things because, we need our lungs to be strong, right? And that's all the things that we are addressing in CHI,
Right.
at least in the behavioral health department.
So it's great to know that you don't want to be in one extreme or the other. You want to try to be in the middle, but that's not really easy for somebody who's feeling panic, how to figure out how to calm themselves down and to bring themselves back to the middle. I mean, I can understand if they're with you in a session, you can give them tips and tricks and, remind them not to be panicked, but it's hard when somebody can't bring themselves, into the middle. So what do you tell somebody that's trying to do that by themselves if they're not sitting in your office and you're guiding them? Is there something you can suggest to help somebody try to get back into the middle so they're not so nervous?
Pretty much what I do with the clients is trying to focus them in the here and now. And with this, I am allow them the space to breathe, right? To breathe, to recognize that what they have in mind is not happening at that moment. And maybe it cannot happen, right? I am trying to tell them that they are doing an excellent job by taking care of themselves, right? But at the same time, I'm trying to explain them, that this is enough. This is the only thing that they can do. Because as I mentioned before, we are fighting with something invisible, right?
And it's real.
And it's real. But at the same time, I am trying to encourage them to do what is in their hands. And at the same time, reminding them you are doing an excellent job by taking care of yourself. You are doing an excellent job by taking care of your family, right? So congratulations about that. So now let's focus right now that it's not happening, okay? What other things good are happening in your life? You have food, you have shelter, you have a job. In some of my clients don't have job, unfortunately. But for those who have a job, for those who are not affected financially, try to say, okay, at least you have a job, at least your finances are stable, and pretty much those kind of things. That are the things that we try to help in CHI.
Right. And I understand community health has a whole gamut of services for people. It really takes care of the whole body. You can get help for almost everything there, right?
Absolutely. CHI has been serving the South Florida. Well, Community Health of South Florida is a non-profit organization that has been helping Florida residents for the last 50 years. Community Health of South Florida offers most of the insurance, and in the worst case scenario, it also accepts people uninsured by providing them what we call a sliding fee income-based scale for those uninsured clients.
So no matter what your economic situation is at the moment, they can try to help you.
Everybody's wonderful to CHI. Everybody's welcome, sorry. Everybody's welcome to CHI, and we value all the patients with insurance or without insurance. And at the same time, Michael, I would like to share with you that we offer several comprehensive services such as pediatrics, mental health, women's center, primary care services, dental, vision for all the clients around our communities.
Wow. And there's a number of the centers. It's not just one location.
11 health centers, to be honest with you. 11 health centers, and they are located in pretty much most of the South Miami area. And we have the Doris Ison Health Center, which is located in Cutler Bay. And we are currently in the process of working on a crisis unit for children, right?
Right. Which actually, I'm fortunately going to be able to do a show about later on.
Absolutely, absolutely.
Yeah. It's a wonderful thing, this Crisis Center for the Children. So I'm going to do a whole show about children coming up.
Absolutely.
I'm very excited about that.
Absolutely. Hopefully we can complete that project by next year.
Yeah.
Because right now it's under construction.
Yeah. There's also one in the Keys, I think, a location.
Yes, there is the Marathon Health Center, which is under construction right now, but I think that hopefully soon it's going to be available.
Right.
For the people living in the Keys areas.
So most likely there's a center close to you, and even if you don't have transportation, there's public transportation. They're in locations that are easy to get to.
Absolutely, absolutely. Yeah. And we value the effort of people, no, to come to CHI to see us, no, and especially to share feelings, emotions, thoughts, and experiences regarding the pandemic.
Right.
So we are very happy of receiving people on a daily basis, no, and providing them the space to vent how they feel.
Right.
Right? Because it's not the same, talking to a therapist is not the same as talking to your friends, as talking to your family. Talking to a therapist goes beyond, because it's somebody that is not going to judge you. It's somebody that is going to provide you empathic listening, unconditional positive regard, constructive feedback, and also congruence at all time, right? It's somebody that is going to see how you're feeling from an external point of view that unfortunately your family members are not able to see, right?
Yeah. So if somebody wanted to take, the resources from there, how do they, is it you just call up and make an appointment, or is there a process, or?
Absolutely. They can always call to 305-253-5100, which is the main line of CHI, and they are going to be connected to the health center, and they can always set their appointment with them.
Right. Yeah, and I know the information is below us right now, which is the website and the phone number if somebody needs it. Because it's really important. People need help now, and they need to do whatever they can to find some help and get some help.
Especially in the community.
Yeah.
Especially in the community. That's what we work the most.
Right. So if somebody's home and they're suffering, do you have like a suggestion maybe what somebody can do now?
Right now, I will
if they're home alone, and some ideas to help them.
Right now, I will encourage people to start practicing some breathing exercise, stretching, practicing mindful meditation.
Like what kind of breathing? What would that be? Just like slow, deep breathing?
Slow, deep breathing. Actually, there's a lot of resources in the internet. Thank God the technology, right?
Right.
We have a lot of resources of people who are professional, who post videos in YouTube and who post videos on Instagram or things like that. So there is different styles, right? There is not only one style, and it's not only breathing. It's like getting oxygen to your body and releasing carbon dioxide from your lungs. Practice it, and this can be accompanied with stretching, mindfulness meditation, working out, eating healthier, and gets the best supplements of vitamin C that you can
Right.
afford, right? Not because the vitamin C is going to make a miracle, but I know that people when they take vitamin C, they relax themselves because they are witnessing that they are taking care of themselves.
Right.
So they feel protected, in other
Right.
words.
So it's trying to bring yourself into the moment. So you're not focusing on any of the fear and the numbers and the panic that's out there and everything that's happening to everybody and all the losses that you have, and it just keeps like keep tumbling and tumbling and tumbling, and it's really, so you're suggesting it's really important to try to just bring yourself here and today, like right this moment, everything's okay, you know, and you
Here and to the middle point.
right,
Mhm.
yeah, and don't just be looking that everything's so severe and
But at the same time, nothing is too light, right?
right,
Everything has to be like a balance between, as always in life, right?
Right.
Everything has to be a balance,
yeah,
right? Not too extreme to get a panic attack, but not to the lightness that you can continue your normal life without thinking
yeah,
that nothing is happening in your environment, right?
right.
Mhm.
So is the pandemic bringing a tremendous increase in in symptoms in people? I mean, is it just like overwhelming what you're seeing, and people are just don't know what to do and they're lost,
Yeah.
and so there's just a large onslaught of people coming to look for help now.
Absolutely, absolutely. There is not only people who are anxious or who are depressed or they feel suicidal. It's pretty much people that are engaging in other behaviors such as binge eating, right?
Right. Which
Lethargic.
actually, if you're going into those other things, they're not helping you. You think they are satisfying you, but they're actually not helping you. You know, over the overeating and too much alcohol and
Mhm.
you know too much excess of everything else is really counteractive, probably, to what you know you're trying to do.
Absolutely, absolutely.
Yeah.
It's not like the best coping skills, no? It's like totally, totally the opposite. People at this time they have to learn to eating healthier patterns, working out more, right? Rather
Right.
than binge eating fast food, or rather than eating or drinking alcohol or smoking
Right.
or doing those kind of things.
You know, there seems to be a syndrome happening. It doesn't have a name yet. I'm sure it will have a name soon, but I've noticed everybody around the world's having the same thing. We had lockdown time, and people had a lot of time on their hands, and they made big lists of all they were going to accomplish, and they turned around a month later and they weren't able to accomplish one thing on the list. That they're just stuck. They don't know what to do next, and they're just lost, you know. So I'm hoping this show is going to bring enough awareness to the different things maybe somebody's experiencing, and to bring resources, so that they can come and talk to somebody like you and understand, because mental health is really something that people are ashamed about, and there's no reason to be ashamed about it. Doctors are now required to learn about it in their education. It's part of their education process. So it's not something to be ashamed about. It is scientifically diagnosable. It has specific symptoms. We know how that we have a whole way of treating things, whether they find somebody, they may need some medication or therapy to talk to somebody. And so it's really not something to be ashamed about. And I really want to get that across to people, because people are ashamed. They think, oh, my head's not okay, so something must be wrong with me, and I can't tell anybody about it because I'm embarrassed about it. So, I mean, would you say it's really good to talk to the people around you and tell them I'm not doing okay, the people that you know, and ask them, listen, I'm having these things. I don't know what's going on with me. You know, would that help somebody to share with a friend? Because maybe the friend is experiencing the same thing too.
And the friend will probably say, "Go to talk to a therapist because I am struggling with my own stuff, so I don't
Right.
I don't have time to to deal with yours."
Right.
Right. Some people could be very receptive, other people can be not too receptive.
Right.
So for that reason, that's the idea of coming to therapy, right?
Yeah.
Because you will have always somebody who is going to be able to talk to you.
Right.
Yes. No matter the approach, no matter the techniques, no matter absolutely anything, there is going to be always somebody willing to, even if the person is struggling as well, even if the provider is struggling as well, because we are human beings at the end of the day, right?
Right.
There is
Which
going
I
to
would imagine you're experiencing more stress because you're having to deal with more stress from people.
Mhm.
It's probably making your job a lot, a little more difficult than normal.
But part of being professional is also learn to separate, right?
Right.
What's yours and what's from other person,
Right.
right? And to know the limits, right? Until which degree I would like this case to affect me, right?
Right.
Until which degree I want to affect the other person. I'm talking about positive things, right?
Right. Trying to take yourself away and don't take on what the person's experiencing, really.
Here in CHI, we have a huge department with plenty of therapists, and we all provide services at the same level. So, we all have our style, but something that we have in common is that we always be there for our patients,
Right.
right? No matter our approach, we are there always for listen them,
Right.
right?
So really, if somebody's having a hard time, call and see if talk to the person on the phone, tell them what you're experiencing. It's really important right now to get help and not sit home and be alone with all of this. And share this video. You never know who you're going to help by somebody, because people aren't talking about it, and it's really important right now that we have to help each other as much as we can. So I'd really like to thank Ricardo for being here today and helping us understand a little more about what's going on with mental health. And I would like to thank the family of Miami Community News for allowing me to host this show. I'd like to thank Tommy for working the magic behind the camera. I'd like to thank Susan, my producer, who's here today. And hopefully you found something enjoyable and informative that will help you. And come back next week. We're going to have somebody else great. And be safe and be strong.